Hello, good evening. I mean, it's the start of the evening before I rush to my clinic. I just had a quick 20 minutes, so let's shoot this video. Exams are coming up. Best of luck. And today's video is on a very important topic. And as boring it may sound, you will at least get 5 questions minimum in your exam on infection control guidelines. Now, this is something which we just take it for granted, but you should know as a practice owner, as a practicing dentist, as a staff in a clinic, what all things you have to be immunized for, what all titers you have to maintain for your staff, for yourself, and what you should do in case unfortunate exposure to blood happens with the patient, because every patient you're not going to check their titer, etc. But when you get exposed to it, and which is very common in dentistry, you can just sometimes prick yourself after giving injections with a scaler. Your staff can prick yourself, etc. You should know what to do at that time because you have to protect yourself too, right? So yeah, let's discuss this. For all the new candidates, I'm discussing one of the past questions of Australian Dental Council Part 1 written exam. This is exactly how your question paper is going to look like in the exam. And you have to know the answers if you have to clear the exam, of course. So yeah, let's start without much ado. A new dental assistant presented to your clinic. This is her first day at work, okay? You are a practice manager who is guiding her and showing her all your clinic policies and practices. So there are certain basic things which the assistant is supposed to know, but every clinic has their own set of customized policies. So you as a practice manager, who's also a dentist, and you double up as a practice manager, you're also showing her around, telling her what to do, what not to do, what is expected out of her, and you're also gaining insight of what she knows. So your practice is located in a remote indigenous community. A remote indigenous community, meaning you are with the originals of Australia. The species is a little different. They have certain set of problems, or I would say conditions, that you have to be aware of. If you have read much about Australian dental exam, you would know that the indigenous community out there, we require to give them certain antibiotic prophylaxis. We need to be aware of certain cultural policies, and because it's a remote area, maybe some sort of extra vaccination is needed, which you wouldn't if you were in the city. Understand? So because you're in a remote indigenous community, your clinic will be having some customization of some extra vaccination policies which you should know, and since your assistant has come probably from a different place, you're supposed to educate her, right? That's why they have mentioned remote indigenous community, meaning certain practices out there would be different from the ones which are practiced in the rest of the world, or even in major cities in Australia. Now, what additional vaccination type your staff are advised to have? A very specific question. What additional vaccination? Meaning she is already having some set of standard vaccinations which as a healthcare provider she's supposed to have. But because she is going to practice now in a remote indigenous community, she's supposed to have an additional vaccination which is mandatory in those areas but probably is optional in other areas. You understand my point? It's like, sometimes you travel to certain countries in Africa and you're supposed to take that yellow fever vaccinations and some other vaccinations which you wouldn't if you were traveling to some other countries. Similarly, in Australia, if you're going in certain states, you're supposed to have some additional vaccination because those areas are having those kind of viruses more than the other areas. So, let's see what are our options. Varicella, measles, mumps and rubella, viral influenza, a history of successful immunization against HBV, that is hepatitis B virus, and hepatitis A. Okay, let me get this clear. Varicella, mumps, measles and rubella, you get it in your childhood. Everybody does. I mean, 99% of population does. So this is by default that you should be having it. Viral influenza is condition based. If you end up with a viral flu and you test positive for influenza, it's actually a self-limiting condition if it's not going above and beyond its timeline. You can choose to get vaccinated with it. or you can also get the vaccination if you are detected with an influenza. So that's all right, and that is place to place based. It's not a mandatory thing. A history of successful immunization against HBV. That is a mandatory thing wherever you practice in the world. HBV immunization. So basically, you already have gotten HBV vaccination in childhood, and you keep on getting boosters until your titer is about 10 something, okay? 10 IU per ml, I guess. So HBV is one of the standard vaccinations that you are already supposed to have any part of the world. So varicella, measles, mumps and rubella, and a history of successful immunization against HBV is mandatory irrespective of where you're practicing. So this is by default you're supposed to be having. Now, if you were to get confused, it would be between viral influenza and hepatitis A. Now, viral influenza, it's basically cold and cough that you can get vaccinated anytime if you require. But hepatitis A is something which is a region-based. So not everybody will have hepatitis A, and it's more commonly in certain areas. So only where it is more common, only in those areas you should get the additional vaccination done. So remote indigenous community in Australia is having hepatitis A vaccinations mandatory in those areas. So this you'll have to mug up, okay? But apart from the standard vaccinations, viral influenza is not a standard thing. It can happen anywhere. So it's an optional thing, and it's not like long lasting something. But hepatitis A, yes, once the antibody is there in your body, it's there in your body. So that's the answer. Now the dental assistant needs to know that. Okay, so actually the question is what a dental assistant is expected to know. A standard procedure with additional precautions, universal procedures with additional precautions, standard procedures with transmission-based precautions, universal procedure with transmobile-based precautions. If you were to get confused in these questions, it would be between universal procedures with additional precautions or standard procedures with transmission-based precautions. What is standard procedure and what is transmission-based precaution? Standard procedure is a basic level of infection control. I think I have a feedback here which I have written, which I'll read out to you. Standard precautions are the work practices required to achieve a basic level of infection prevention and control. The use of standard precaution aims to minimize and, where possible, eliminate the risk of transmission of infection, particularly those caused by blood-borne viruses. Standard precautions apply to all the patients. There are certain set of standard procedures that you have been following by default. You wear your gloves, you wear your mask, you wear your PPE. These are standard based precautions, okay? Additional to it, the transmission based precautions will come to it. All other body fluids except sweat, regardless of whether they contain visible blood, non-intact skin, mucous membranes, standard precaution consist of the following practices. Hand hygiene before and after the patient contact. The use of PPE, which may include gloves, impermeable gowns, plastic aprons, masks, face shields, and eye protection. These are your standard precautions. The safe use of disposable of sharps. The sharps, you dispose it off in another container, where the biohazard is mentioned, that yellow color box. The use of aseptic non-touch technique for all invasive procedures, including appropriate use of skin disinfectants. Routine environmental cleaning, reprocessing of reusable instruments and equipments, waste management, appropriate handling of linen. Standard precautions are the minimum infection prevention and control practices that must be used at all times for all patients in all situations. So this is the basic level of thing that you have to do in standard precautions. Transmission-based precautions are used in addition to the standard precautions when standard precautions alone may be insufficient to prevent transmission of infection. They are used for patients known or suspected to be infected or colonized with epidemiologically important or highly transmissible pathogens that can transmit or cause infection. I'll give you an example. See, all the things that we normally do in the clinic are standard precautions. But when we had COVID, we were literally wearing that hazmat suits. Have you seen that? Which looks like a suit of an astronaut. It's totally covered from everywhere. Like not a single part of your skin is exposed. You are just practically covered. in our standard precautions, we are just wearing the face mask, or even if you wear a face shield and gloves, our ears, our forehead, or something like this is still air is circulating through, basically, right? But when you wear a hazmat suit, you are just fully covered. There is nothing, no air circulation happening inside, and you are wearing extra masks, those N95 masks, etc. So nothing, not even the eye part is getting exposed anywhere. That is an extra precaution. That's a transmission based precaution suit. You get my point? So any assistant should know what is the standard based precaution, and if a patient is suspected to have, say, HIV or COVID-19, for example. Now that it's gone, I don't expect any more questions on that. I think that was a one-time pandemic and it's not gonna come back. Maybe some other pandemic will come back, but not this. But anyway, whichever pandemic, and if it's airborne, you are going to have a transmission based protocol in place, and you will be wearing that hazmat kind of a suit again. So this is the difference. You can take a screenshot of this, though it's mentioned in your infection control book, but I'm just reading it out so that this video becomes more comprehensive and you don't have to just go and open it up again, but you do remember what all this is. That's why I'm taking out time to read everything. So now coming back to this question, the dental assistant should know standard precautions with transmission based precautions. Universal procedures are different. They are having little minimum things than the standard procedures, hence we go with standard procedures. Now, a dental assistant in Australia should not do what? IOPA, they do it. Diet evaluation advice, she can do it. Impression taking, yes, a lot of assistants do that. Planning and implementation of oral hygiene measures, yes, they can do that. But what they cannot do is place an ortho bracket. Placing an ortho bracket is a very skilled thing, and you have to study orthodontics for it. You should know the angulation, which bracket, how to place it. That is the job of a dentist, not the assistant. So they can do the rest of the things, but not placing an ortho bracket. Same for the hygienist. She cannot place an ortho bracket. What an hygienist can do, they can do scaling, polishing. They can even apply pit and fissure sealant, but fillings, I don't think so. Placing ortho, again, no. Extractions, no. Now, post-immunization serological test results for a healthcare worker who has completed the series of vaccinations against hepatitis B is less than the value required for immunity. The healthcare worker should. So basically what the question is saying, normally it should be 10 IU per liter, something like that. For hepatitis B, now she got tested and the value has come less than that. So what should that healthcare worker do? Because you need to have the antibody to a required level so that you are protected from hepatitis B. Have liver function test performed to assess liver damage. Refrain from performing any exposure prone procedures for a period of 3 to 6 months following a full immunization. No, you don't have to wait 3 to 6 months. Receive an additional immunization followed by post-immunization testing. Yes. Undergo the full series of hepatitis B vaccinations followed by post-immunization testing. You don't have to go for full series. You did get a titer. It was just less. It's not like you had zero titer. If you had zero titer, then you would go with option D. But the question says the value is less than what is required. So there is some antibody, but it's less than what is required. That means she did receive vaccination, but it's not up to the mark. So you get a booster dose basically. And then you test again whether it's matched the level what you're expecting. If not, you get another booster dose. This is for your prevention. So you and you have to make that it's your staff. So you are kind of responsible for their health. So you have to make sure your staff gets it. A patient with no positive history came along for scaling. No positive history. That's what the patient has told you. Do you believe all the patients? Never. Never. On your life, never. Yes, but you do take the history, and even though you should have the best of the belief, never ever trust the patient. During scaling procedure, the assistant picks up the scaler and punches her finger. What should be done? Okay. During the scaling procedure. So the scaling procedure has started. The scaler has touched the patient. Probably there is some contamination on the scaler. Maybe there was blood while scaling. And then the assistant picks up the scaler, punches her and probably there is a little blood contact with the assistant as well. What should be done? Complete the procedure as nothing has happened. That's horrible. No, you should not do that. Check patient's blood for hepatitis B antibody. Check patient's blood for hepatitis B antigen. Check assistant's blood for hepatitis B antibody and HIV antigen. Check assistant's blood for hepatitis B antigen and HIV antibody. Okay, let's get this straight again. Complete the procedure is not an option. You should stop immediately, okay? And you have to call another assistant, change the scaler, and then you can proceed probably. Check the patient's blood for hepatitis B antibody. Let's understand the difference between antigen and antibody. You probably do. I'm just brushing it up. An antigen is the introduction of the foreign agent in your body. When that antigen arrives in your body responds it by producing an antibody towards it. Now, if your body already has an antibody, it would just immediately go and neutralize that antigen. So, if your body already has an antibody, you are protected. But if you do not have that antibody, it would take some time for your body to prepare that antibody. That means during that time only the antigen is active. And when the antigen is there in your body, which would stay for a short period of time, it's not gonna be like forever and ever, that is the active phase of infection. Now, since it's your staff who has got injured, but you have made sure before the staff even comes to assist you that they are already protected by having adequate levels of antibodies. So no matter if an antigen enters their body, they would still be protected. You have already done testing of HBV. HIV antibodies, there's no vaccination for HIV at the moment. So only if an active HIV infection is there in your body would produce something. But otherwise there is no antibody for HIV that people introduce. Basically there is no vaccination for it. The only vaccination we have currently is for HBV, right? So already knowing that your assistant has a full immunization against HBV, I do not need to check my assistant. What I can check my assistant is for HIV antigen. But is that option given to me only? No. Before I check my assistant for HIV antigen, which I should be doing it, I have to check the patient. I have to check the patient for what? For antigens of what? I have to check the patient's blood for hepatitis B antigen, whether he is infected or not. If in his body there is antibody present, I'm okay. But I need to check if he's an active case of hepatitis antigen or not. So now coming back to the options. Complete the procedure as nothing has happened is not an option. Check patient's blood for hepatitis B antibody. No, I do not want to check his blood for antibody. If he's already immunized, great. Antibody means he's already protected. What I'll do with it. But I need to check if the patient has hepatitis B antigen. Is he an active case? That is what I need to know. Okay. Check assistant's blood for hepatitis B antibody and HIV antigen. My assistant is already having hepatitis B antibody. Checking for HIV antigen is a good idea, but if only that alone option was mentioned, I probably would have chosen that, but that is not mentioned. It's mentioned with antibody of hepatitis B, but that is not what I'm looking for, so I'm not going to go with this option. Check assistant's blood for hepatitis B antigen and HIV antibody. Having an antibody for HIV means the patient already has HIV, and the assistant having an HIV is something else. You understand? So I'm not going to check the assistant's blood for HIV antibody and hepatitis B antigen. Having a hepatitis B antigen means you are an active case of infection. If she's already acutely infected with hepatitis B, I'm not going to allow her to work unless she's cured of it and has a good level of hepatitis B antibody. You're getting my point? Antigen and antibody. So the only thing I need to check if my patient is an active case of hepatitis B infection. That's it. Simple. Many candidates have got confused over this, but it's just basic knowledge of what is there, what is required. The options are very tricky and trying to confuse you, but if you actually read, it's not confusing at all. And that is why I want you to read and understand the basic level of vaccinations. What is an antigen? What is an antibody? What is required? Understand? So yeah, that's it. Yeah, it was a lot of talking, and I think it's 12th today. 13, 14, 15, 16, 17, 18. 6 days to go for your exam. How are you feeling, guys? All the exam going candidates. I'm as nervous as you. I mean, I'd given my exam in March. Yeah, it was March. On 13th and 14th of March 2022. Wow, it's been 3 years. And I had many things going on at that time, but I'm sure you must be having too. And just today, my mother-in-law is here, by the way. All those candidates who are done with this explanation, you can just move on. I'm just discussing about my life. Sometimes I do. I just want to do it. So many candidates message me. I don't discuss much, but sometimes I just feel like doing it. So anyways, my mother-in-law is here and she's a really nice lady, bless her. Husband keeps on traveling most of the time, so today I just went to buy some shoes for her. She got knee surgery done, and by God's grace she's walking properly now. So thought let's make her walk more. So we just went to get a good pair of shoes for her, and while shopping for her I just realized it's been more than 2 years that I myself went by myself alone and actually had some time for myself just to shop around. I think that's life with a toddler. You just cannot have it all. And I was just looking around and I'm like, oh my god, it's been ages since I've just looked around and shopped something for myself, like literally. So anyways, the second day of your exam, which is March 19th, is also my birthday. And yeah, I'm thinking of going on that day and asking my mother-in-law to take care of my child just for a few hours. Sometimes you need me time, and I'll probably just do window shopping or buy something. I mean, I've just forgotten that feeling of, you just tend to not put yourself up when you have a toddler and you have to manage so many things, your patience, you guys. Like I just had 20 minutes, and if I wanted I could have just taken a small nap before running to my clinic, but I was like, no, I'm responsible for you guys also because of the motivation that you guys send me. Like every day I have thankful messages from candidates all over the world telling me how they are so thankful for the videos that I make. Not that I make these videos to get some appreciation or something, but I just feel responsible. Like I think I've quoted this many times before. Not that I'm a superhero or something, but in that Spider-Man movie 2, the Tobey Maguire one, he did mention, when you have some power or some skills, do you just chill or you feel responsible and you go out and help even though nobody's asking you to do it? And I feel responsible because there are so many concepts which I think today's dental schools and the teachers are not that passionate about in teaching the students, and equal blame goes on the students as well. They're more in their phones than books, but then there are a lot of good students who really want to study but lack a proper guidance, and I was one of them. And though books were really helpful, I'm very grateful to all the authors who have devoted their lifetimes in making those books which helped me make a better person and clinician. I also felt if only there was that one teacher who would just guide and be so passionate about dentistry that we could see that passion and not feel like we are just wasting time and studying more about it or getting a better knowledge. Be the change you want to be, right? So since I get so many good messages from the candidates saying that these videos are helpful for them, I really want to take out time and do so. And it also makes me feel better. I feel instead of cribbing, I am actually contributing something. And even if one person out of you all, like, wow, I have like around now 6,000 subscribers over my YouTube, I guess, close to that, and Facebook another 5,000 plus. So out of so many thousands, like all dentists, if even one of you can I mean, to even one of you, if one of my videos help in making a better clinician, wow, I mean, it's good. It's basically spreading goodness in the world, right? So, yeah, about that. But yeah, I need to start prioritizing a little time for myself too. It's just exhausting. My son is becoming a bit independent now, so that's great, but still, he's a toddler, you know, he just turned 3, and it's a great time to be around him, but managing patients, managing 3 clinics, house, especially when your husband's traveling for like so many days a month, it's tough. It's really tough. I miss hanging out with friends sometimes, but but I just don't have the time because there's so many things in the list that need to be done. So, anyways, I'm sure a lot of you must be in a similar situation. I'm not an exception. I mean, I'm just saying it out. That's it. So, anyways, best of luck for your exam, and I hope it really goes well for you all. You are not going to lose even if you don't pass. Please don't be fixated on the result. You are always gaining something when you read more, and this knowledge will always be there with you, imbibed inside of you. It cannot be lost. What goes in your brain stays there. So yeah, that's about it. Have a nice day. Bye bye.